Hello everyone, in this video we're going to be discussing how permanent pacemakers can lead to tricuspid regurgitation and ultimately right-sided heart failure. Now, this is an image from UWorld that is clearly going to show how these pacemakers can lead to tricuspid regurgitation. So here is the pacemaker, and as you can see, the right ventricular lead is going to travel from the superior vena cava to the right atrium, and then through the tricuspid valve into the right ventricle over here. Now, because this lead is passing through the tricuspid valve, it can disrupt tricuspid valve closure, and then this can ultimately lead to backflow of blood going from the right ventricle into the right atrium. And over time, this can damage the tricuspid valve and ultimately result in right-sided heart failure. Now let's do a question. A 78-year-old presents with fatigue, abdominal discomfort, and lower extremity swelling. She also occasionally feels an uncomfortable pulsation in her neck. 6 weeks ago, the patient underwent pacemaker implantation. Physical exam reveals bilateral lower extremity edema and a tender pulsatile liver. The lungs are clear on auscultation. CPC is normal. What is the most likely diagnosis? The most likely diagnosis is going to be tricuspid valve regurgitation. The patient has all the symptoms of right-sided heart failure, like JVD distension. And because she has a pacemaker that was implanted, that is most likely going to result in tricuspid valve damage that can lead to tricuspid valve regurgitation that can ultimately result in the right-sided heart failure that she's experiencing. Now, it's not going to be due to aortic valve regurgitation, which is answer choice A. This is most commonly a result of aortic root dilation as well as rheumatic heart disease, and this will cause a left-sided heart failure, and what this can present with is crackles in the lungs because of fluid in the lungs that can result from blood backing up into the lung. Constrictive pericarditis can also result in right-sided heart failure, but because the patient has put a pacemaker in, the most likely answer is going to be C, which is tricuspid valve regurgitation.